The following is a conversation. It has the features of any conversation, such as imperfectly expressed thoughts, ill-considered opinions, and the notions of several sleep-deprived brains. Try not to get your stethoscope in a twist about it.
Today, it's an Am I the Asshole episode, but right now I want to mention that the announcement about Frolics went out the other day, and I wanted to ask if any of you will be participating in Frolics in 2025. Do we know what this is?
Dave, I don't want to be I'm going to be the party pooper here.
We know.
Be the spoil sport. It is what I do. I spoil all the sports.
Spoil your sports.
I have a really hard time with humor at the expense of somebody else. Even quote unquote good-natured humor, if it is at the expense of another person, I don't feel very comfortable participating in that.
All humor, I think a lot of humor is at the expense of someone.
How do you feel about self-deprecating humor?
Sparingly.
Follow up.
Yeah, because I have a question about what we mean by at the expense of, because is it at the expense of someone if they also find it funny and humorous? Is that at their expense?
See, the reason why I have this rule is because I have family members that are a little bit more emotionally volatile. And often, at their expense, they're laughing along. And then sometimes, I don't know, maybe I have caught them on a particularly difficult day, and all of a sudden, they are distraught because they feel like they're being attacked, right?
Yeah.
And because I've experienced that a lot, where like it's really hard to tell like where the line is depending on where somebody is emotionally. I get that Dean Cooper's going to enjoy the jokes at Dean Cooper's expense, but also maybe Dean Cooper's in a bad way, and it just kind of hurts his feelings a little bit too much, and that I'm very reticent to participate in.
Could anyone go through a roast? Does anyone feel like they could like sit there, be roasted, and feel good after it?
Oh, yeah.
You think so?
1,000%.
You could be roasted.
Yep.
Yeah.
Love
Depends
it.
on
I think I could be roasted for about 2 jokes, and then it would go.
Yeah, like this
quick decline.
This was fun for the first 3 minutes, and now
Yeah.
we're done here.
See, I do worse with compliments. I don't think I could.
Interesting.
Same.
It'd be worse if
I think that would be
I
horrible.
actually think I want no observations on myself ever. Is that this?
I wish
don't
to
wanna
not be perceived.
I would like to never be perceived.
Well, it is something that you could do.
Yeah, I mean,
I will note that years ago, the Writing and Humanities program was tasked with teaching the people in charge of Frolics what comedy is and what it isn't.
yeah.
You took them through improv.
Oh,
improv
God.
I mean, just a little bit. Like I think it was after a particular incident where things went a little bit too far. And
No, I know, because for a while after my M1 Frolics, they considered like not doing it anymore because they used to do Frolics at the same time as they did faculty awards. And apparently there was some faculty there getting faculty awards who did not know that this was an NSFW comedy show and were deeply, deeply offended when it's like, all right, now we've talked about like dicks and vaginas for 2 hours. Let's give you your best teacher award. And in
To be
hindsight,
fair,
if
there is a faculty like awards, that's work. It can't be not safe for work and also work.
I
That doesn't
completely
work.
agree. To this day, I'm still not completely sure. I think Frolics used to be more innocent, and then it veered NSFW. And then
I don't know. This is one
it.
of those things that has existed. It has existed so long that it's now tradition.
Yeah,
and I think it was always a bit.
Where do you stand on traditions? Do you think they can be altered? Do you think they can be
for sure.
eradicated?
I refuse to submit to peer pressure from dead people.
Either
it's good or it's not.
This is the season of traditions. I mean, traditions are rampant during this time of year. And as a person in her late 20s with family members also in their late 20s, I feel like a lot of traditions are changing, and people don't like that.
Yeah.
Meandering in the margins of medicine, it's the Shortcoat Podcast.
Weird news,
fresh views,
helpful clues, and interviews.
by students, for students.
Subscribe to our weekly show at theshortcoat.com.
Welcome back to the Shortcoat Podcast, the show that gives you an inside look at medical school from the students drinking from that fire hose. Happens to be a production of the University of Iowa Carver College of Medicine. I think they know about it. I'm Dave Etler. It's crowded today in the SCP studio. Shortcoat, say hello to MD PhD student Riley Behan-Bush.
Oh my gosh, number 1. Woohoo.
Say how do you do to MD PhD student Miranda Schene.
Howdy.
Say what ho to M3 Jeff Goddard.
What ho?
Say what cheer to PA2 Julie Vuong.
Yeah. Hip hip hooray.
Say
I'm not Julie Vuong.
To M2 Holly Hemann.
That was my favorite.
Yoo-hoo. It's like the Sim sex noise. Woohoo.
It's a crowded room today because likely because we're doing an Am I the Asshole episode, which I love. But first, I want to remind you, Shortcoats, that we love to hear from you. So go to theshortcoat.com/tell us to tell us what you think of our work. CCOM grad did that recently to share his thoughts on a recent episode co-hosted by 1M4 and a bunch of PAs on the scope creep fight currently happening between the AMA and the AAPA. It was a very long email. I did share it with all the co-hosts, but I'll summarize it by saying that the writer felt the episode lacked diverse opinions, and they were concerned that a fear of political backlash might have silenced dissent. The majority of their peers oppose nurse practitioner and PA independence, favoring physician supervision. I don't know if that's a scientific conclusion, but next is, although PAs have rigorous training, nurse practitioner training is watered down and inconsistent. Their opinion, not mine. Nurse practitioners overprescribe and handle complex cases poorly, causing physician burden. Again, I don't have any knowledge of that. And nurse practitioner independence is driven by lobbying, not training quality. Again, I don't.
To be fair to that last point, all fighting against nurse practitioner independence is also driven by lobbying. As a member of the AMA,
Julie
I recognize that this is what we have done here.
Julie was on this episode. Was there anything in particular you wanted to respond?
So, I mean, it's true, there was only one medical student, and I kind of really wish that there was another one just so it could be equal, but it's just who signed up. Maybe the PA students...
it's not how this show works,
maybe the PA students just filled up the spots too quickly, so would have been preferable to have 2 medical students, but that's how it ended up. In regards to like the whole peer, majority of the peers, I read the email, and it sounded like they were stating that behind closed doors and away from the PA's ears, they were opposed to PAs, how they're working and how they're doing their practice.
I had a different take on that letter, which was that they didn't agree with independent practice, but they did feel that PAs were well educated and had the ability, right?
Yes.
Okay, I just want to make sure that.
They did clarify that, but they also talked about how they were feeling that like the decisions made by NPs and PAs, and they set this together, were sometimes like a point of griping for the attendings and residents.
Yeah.
Which it's a shame that kind of talk doesn't really get to PA's ears, because it's good feedback to get and definitely a valid criticism to have. And if there's like an issue that's such an issue that it causes like a larger group of people to complain, then please bring it up.
I think probably to the point of this episode as an AITA episode, Americans especially, I think humans generally, but Americans especially really don't like confrontation. And so if there's a problem between physicians and PAs, physicians are just going to gripe about it instead of talking to the PA. And I think that's not helping anybody.
There is a professional way to do this.
I don't want to get too off track. And I didn't read this email, and I was not on this episode. I do question anybody that makes a distinction between, like, so they're talking about like PAs and NPs, and then they're also like, oh, well, PAs are well trained and NPs aren't. And I go like, is there a potential, and I'm not accusing anybody, and I don't want to, oh, dear Lord. Apparently there's an unpopular opinion in the studio. Someone just threw a laminated sheet at me. Thank you, Riley. So I just question whether or not the word nurse in front of NP might have been influencing this person's decision-making, because nurse is usually a female-dominated profession, and PA and MD is more of a male-dominated. I'm not accusing. I also don't want to like poison the conversation. However, I find it interesting.
And I don't think that we know the gender of the emailer.
No, we don't.
Right. It could be either.
I guess what I want to say is this podcast is important to understand something about this podcast. This podcast is not journalism.
Correct.
This podcast is conversation. And as the disclaimer says at the top of every show, we basically take no responsibility for our correctness or not correctness. We're just chatting.
I will to meet the emailer where they're at, which I think is a fair thing to do. I will say I don't know that there is necessarily... there's definitely bias in our class, in our medical school here, in favor of PAs because we are educated with it.
Right.
And so as medical students, we may not have a lot of experience practicing with PAs so much as being educated and going through the trenches with them. So we see them as allies, we see them as peers, because we just went through a really tough didactic period with them. When I'm out and practicing and I see PAs and NPs, I don't really interact with them that often. I'm going to be honest with you. So most of my experience interacting with mid-level providers, even though I know a lot of people don't necessarily love that term, but like it's as fellow students, and I'm on their side. I just am. They're my friends.
Yeah. One thing I did want to make sure was like known for sure was the purpose of the last episode when we were talking about the AMA versus the AAPA is not that the PA program and like our hosts were on the podcast were 100% for PA independence.
Because we
weren't
kind of, entirely.
We kind of ended our show on it depends. It's not perfect. There are some scenarios where we could definitely use some more improvement in terms of wording, in terms of like specifics, which I thought that we discussed. But I just want to make sure that that message is clear. Mm-hmm. There's nuance to it, and it's good to have a conversation about it.
I'm glad you reached out to us, CCOM grad. Appreciate that. It's always nice to hear sort of a counterpoint when we do these things, and I mean, they suggested a podcast episode comparing MP and PA education rigor.
I didn't really love that. Yeah.
And I'm not going to do that, not because it's not a good idea. I mean, it could make for an interesting episode. I just don't have the resources and the time, and none of us have the resources and the time to put such an episode together.
Most importantly, none of us have the expertise.
Yeah. I mean, we could bring in outside people to talk about it.
Not have NP students around.
Bring one on.
I was going to say, do we even have an NP program?
Yes, we do.
We do.
Yep, in the College of Nursing.
Got it.
It made me think about like maybe I could like recruit a student from that school and they can find some faculty to come on. But I'm going into rotation soon. Like, maybe I'll have another crisis and then do another didactic year is what I was saying in our chat. But I don't think
Let's hope.
Probably not. Things are looking fine, unfortunately, for everyone here.
Oh, God damn it, Julie. Anyway, like I said, thanks for your feedback. Appreciate it.
Keep writing. Drives engagement.
Keep writing. Mm-hmm. Listeners, is your life so perfectly arranged that you have nothing better to do but to judge other people? Well, not us. Wait.
I feel very attacked.
Let me say that again. Listeners, I think I wrote this wrong. Listeners, is your life so perfectly arranged that you have such better things to do than judge other people? We don't.
Nope.
Okay.
Yeah, that makes more sense.
I don't want you to edit that. I want you to leave it just like
Wait, let's try to make this a low work episode. I'd love that. Oh, shit. We're getting off the bus for another tour through the alleys and broadways of the Am I the Asshole subreddit, curated by our guide, Holly, who's definitely NTA. What you got for us to pass judgment on today?
Yeah, so we've got a bunch of different stories. So we're going to start with one that I feel like has a lot of common themes that we've talked about in other Am I the Asshole episodes, mainly around the admissions process and the idea of resentment, too, around the admissions process.
Okay. Let's hear from this person.
Medical school isn't really a thing in my country. You just take an entrance exam fresh out of high school, and if you pass, you're allowed to study medicine at any university you want in the country. My twin brother has always known that he wants to become a doctor. He started studying for the entrance exam 10 to 11 months in advance to maximize his chances. Sadly for him, this December he got into a bad accident. He ended up getting major injuries and was even in a coma for 3 days. He most likely has to deal with lifelong disabilities, some of which completely bar him from certain specialties according to the university's advisor. So, he decided to put his doctor dream to rest and decided on another major. This is the part where I may be the asshole. Around the time when my brother had to come to terms with his dream being crushed, I decided I want to become a doctor myself.
Dude.
The more research I did, the more I realized medicine was for me. At first I was being secretive as I didn't want to come off as insensitive, but it didn't take long for him to find out. At first he was calm about it. Later on, he started making passive-aggressive jabs at me multiple times. On the result day of the entrance exam, my family along with my grandparents all gathered in a room. When I read the letter out loud that said I got accepted, my brother started crying and silently got out of the room. Before I knew it, more than half the room got out to comfort him. Needless to say, the whole vibe was ruined. By now, I had a lot of anger built up, and that day was the final straw. I went to his room and we got into a fight. I don't even remember what we said to each other. I just remember both of us crying and yelling. Well, the semester starts in about 3 weeks, and I'm 100% planning on still going despite his feelings. Am I the asshole?
Okay.
There's
so
a
everyone
bit
make
to
your
that.
decision.
I need my thing. Oh,
Yeah. Okay.
Wow.
Ooh, look at us split.
Wow.
Yeah.
This is like the
I'm a
first
little bit.
Yeah,
I have parts
doing
of it
this.
that I would like to say
Yeah.
this too, but most
there
of
are parts of it, like going to medical school, not the asshole.
Yeah.
I agree.
Yes.
Some other things,
Yes, that's
Yeah.
exactly why I'm in the middle, where it's like you are kind of the asshole, but not for the reason you think you are.
Yeah, I think the assholery comes in with how he reacted to his brother crying.
Yes.
Because I think the brother's feelings are also valid.
Yeah.
This was his dream, and he was told he had to give it up. Which also, I want to say, as the current president of MSCCI,
Wait. Yeah. Hang on.
you do not need
Is
to do
the
that.
advisor the asshole
The
here?
advisor is definitely an asshole.
Oh yeah.
Yeah.
Although
Oh, yeah.
I don't know what it's like in other countries.
That's true. I don't.
They
I
did
don't
say
know
they were
the
not in the
process
US.
either, but
But-
and they didn't say which specific country they're in.
Is
either,
their
so-
country the asshole? Perhaps.
possibly?
Yeah, I almost feel like this is just a case of like a lot of emotionality going overboard, because it's like, yes, it does suck that like your brother's disappointment is like deadening the day that you feel should be like, you know, about celebrating you. But also like, I very much, again, on a much smaller scale, I do sympathize, because this is sort of the feeling I felt when like my med school cohort graduated and I was still back in my PhD phase, which at the time I was having a bit of a rough time with. So there's an element there of like, it sucks. And could your brother have like tried to process those feelings and not spoil it? Yes, but it's also not his fault that this is a really overwhelming disappointment and you're not dealing with it well.
Could your
you
brother
know?
have had a human feeling
Yeah.
that needed to be to be respected? And
Particularly because this is a high school exam. They're 18 years old.
Yeah.
Also, good point. Yeah.
They're emotionally volatile generally.
Yeah.
Right.
Yeah.
Two 18-year-old boys.
They're actually
If
both
you guys
17.
had known
17,
me,
I'm sorry.
if you
Yeah.
guys had
Oh,
known
geez.
me when I was 18 years old,
Yeah.
you would have hated me. Ah, damn
Yeah.
it!
That's why it's like, I wish
I have
this
to
like,
edit again.
this is why this like NTA, YTA, I wish it was a cube, because I want like a thing here that just says like,
Get on it, Dave. Make it
like,
cute.
I'm gonna make
Yeah.
a cube.
I want a thing that's come back to this in a decade, and you'll probably both like realize that neither of you is
Little
a bad
long for
person.
a side of the cube. But
Yeah.
we'll work on it.
I feel like I also want to say like the fight aspect, because that was the part where like, okay, they have this big party. Maybe the party could have been less big or like a little more sensitive to the brother's feelings. But again, I also feel like it is an exciting day for the person who has the entrance exam. Like you should not have to dull your excitement in order to kind of help someone else.
Perhaps a conversation ahead
you
of
also
time.
don't
with the
have
Yeah,
brother.
maybe a conversation
For
ahead of
crying.
time. To,
I mean,
like,
real
let him
talk, but
know.
like, I don't know that I would have invited my family for that letter. I might tell them afterwards and get excited, but
Yeah,
Yes,
I think
yeah.
there could
Open
have
that
been
in
like some
private.
sensitivity there.
Yeah,
But
I think the
also,
brother
feel
just
like
shouldn't have
for
come.
the fight aspect, I have siblings. Sometimes when I'm fighting with my sisters, what it really is I'm acknowledging like this really sucks for you. And then like she doubles down on being sad about it, and now I'm mad. Like now I'm giving you an inch. And you've hit me back, so now I'm going to hit back.
Families
not
are-
actually, like figuratively hitting back. So I feel like siblings fighting at 17 is like, if we're going to say that's why he could be the asshole, is like fighting back with his brother about the emotions, odds are he was acknowledging his brother's emotions, but
Still the asshole. I mean, you know, you could be naive 17. 17.
Yeah.
I was.
by default,
I feel like you could.
Yeah.
fair.
Yeah.
If an-
Most of the
if
time,
by-
I would say by default.
If
As
by
a
if
former
by
high school
asshole,
teacher, yes.
Yep. Yeah.
if by asshole you mean somebody who makes egregious mistakes,
Yeah.
I would like
I'll
to
raise
add
my
a
hand.
layer to this one, which is they're twins. And I feel like that adds like this added layer of like, I'm not a twin, but I can imagine the twin experience of like, you've gone through life, you're always doing the same thing. And then like one decides kind of after the fact to do something. And then like you could get angry about it. Or like, again, twins always doing the same thing and then deviating.
Yeah.
There's like this added element.
And
of
that's
the
what makes like the
twinness.
timeline so like difficult too, because this is when the brother would have also been doing that same thing, and now he's not. And the accident, like, it sounds like pretty recently happened. So that's also like, this is all in a very like less than a year time period.
Yeah.
Yeah,
I
that's
wish
why
I
I'm going to
could-
go with nobody's really at fault here. I think they're
Yeah.
just
Yeah, I don't-
emotionally volatile. They'll get over it. They'll
Yeah.
heal.
This is very much an NaH type of situation.
Yeah.
Oh.
They'll be wearing matching Christmas sweaters in no time.
Yep. Oh yeah.
I still think it's kind of mean because like
It is mean.
the thing is the brother who
I'd
like,
be curious, what do you think is mean?
it's like the idea that the brother was holding space at least to be there at that event, and then he had an emotional response and he excused himself, and he's trying to like make things okay. Of course, his family notices and they're going to care for him. And the person has this great achievement doesn't hold any space. Like all they do is like take those like emotional responses from their brother and kind of take that as a slight towards them instead of realizing that, hey,
yeah,
like
this is another case of if the person had gone back and read what they wrote, I'm pretty sure they would have been like, hey, wait, I don't need to submit this. I have my answer. When he said his brother ruined the vibe.
Yeah, that's
like,
an interesting way to
I would
phrase
feel
it.
like I would like more context though, because maybe the brother has always ruined vibes. This is like a consistent. This is like a consistent.
Maybe the brother is a chronic
dynamic.
vibe ruiner.
In which case, like that, because I feel like friends of friends, I know people who have energy vampire experiences with family members that simply ruins every good thing in life, and there just gets to a point where you can't do it anymore.
And to be fair,
maybe
like,
the context could be twin brother was always an energy vampire.
To your point about being twins, like I understand that twin A, who originally had the dream of being the physician, is having a bad time with this, right?
Yeah.
But I also understand that twin B wants to be an individual that gets to be celebrated.
Yeah.
And he didn't get that. And now he is back to being just a twin, right? He's just the brother of the guy who's suffering instead of being the individual who was successful. I can understand that in the moment you're like, that kind of sucked. This was supposed to be a good moment for me. And I go back to not really being about me.
And also probably, no matter what they said, or say in this thing, they probably feel pretty guilty about it.
But to Julie's point, probably the better response is brother walks away. You don't follow. You just let.
Let it go for a little while.
Don't fight about it.
Don't fight about it. Yeah.
Well, as most people would recommend, if you're going to address it, in that given moment of emotion is not the time to address it. The time to address it is about a week later. 17-year-olds don't know this.
If I was going to say, if I'm going to give anybody advice, it would be we've talked about it on the show before. When I get activated, it's not the right time to make any decisions or make any.
Everyone who said don't go to sleep angry needs to reevaluate that advice. Personally, I think you go to sleep angry, you wake up, and you decide, am I still angry or am I not angry?
Yep.
And then you have that conversation.
And I do just want to make this point. Even though they're 17, I do not use that as an excuse. It's okay. Yeah.
Like a week ago, my wife sent me a message, like a very emotionally volatile message that was something along the lines. I was like, I don't know if I can be a mom. It's really hard. We've got a 4-month-old, right? And like, blah, blah, blah. Yeah. And then like, I'm in clinic, so I don't see the message, right? Several hours later, I get another message from her. I took a nap. I like him again.
Yeah.
It works.
We call, in our house, we call that turning it off and turning it back on.
Yeah. In the immortal words of John Mulaney, do my friends hate me or do I just need to go to sleep?
Yes, exactly. All right. Shall we go to the next one?
Yeah. Story number 2, kind of on our earlier lines. I don't know if this was when we were recording, but about humor in medicine and what jokes are appropriate to make with your doctor and what if those jokes make people uncomfortable.
I like this one.
My husband and I, after years of infertility, are in our 2nd trimester of pregnancy. It's safe to say we both have some trauma from it, but my husband, unlike me, does not find comfort in the dark jokes I sometimes make about it. I have worked in surgical settings, and my OBGYN is someone I worked alongside with as well. I trust him with my life and my pregnancy. He's an older gentleman who reminds me of my grandfather. We've saved lives together, and we both have that same twisted healthcare worker's humor. So I have a solid bond with him. At the most recent visit, husband was also there as we're nearing the end of our visit, and Doc says, "You're exercising, doing everything right, no drug use. I know the drug question is a joke." I responded, "I mean the tiniest bit of meth just to get through the day." He laughs. I laugh. Husband quickly says, "Haha, no, she doesn't." We get back in the car and my husband is pretty annoyed that I made a joke like that. I apologized, told him it happened so quick that it didn't even register that it would hurt his feelings. And obviously Doc didn't take it seriously. He pushes that some things shouldn't be joked about. I try to explain that a lot of healthcare workers do make jokes like that, because if we didn't, we wouldn't be able to handle the things we deal with. I do understand his side to an extent and fully agree that a joke isn't funny if someone takes offense to it. But on the other hand, am I not allowed to continue to bond with my doctor if that's the way we communicate? Does that make me an asshole?
Does that make...
I was looking. Yeah, Holly was about to be very controversial in this room.
I don't think that makes you the asshole.
Okay. Oh.
What does, Dave?
What does, Dave?
Say more.
What does?
I think...
What does make this woman an asshole, Dave?
The fact that...
This pregnant woman,
Dave.
Go ahead, Dave.
Just
Hold
go
space
ahead,
for
Dave.
infertility.
Come on, say it with your chest, Dave. Come on.
I'll
your
hold
opinion.
space for you.
Yeah.
Damn. This is why I'm concerned that 60 some odd % of my co-hosts are women.
Why is that concerning, Dave?
68% of my co-hosts.
Do you feel like a minority, Dave? Do you feel talked over, Dave? Do you feel ignored, Dave?
why are you so afraid of women?
Why are you so afraid of women, Dave?
I love women. I just wish they would. I just wish they would shut up.
His voice cracks as he says it.
Okay, here's the only part I think that she could have been more sensitive. And she does acknowledge this later. I think she underestimated that the trauma that her husband has experienced. Not that she could, not that she could have really anticipated that level of trauma. So maybe it's not, maybe it's hindsight.
Yeah, dare I say it's maybe his job to communicate.
She did say this,
but
she did say this afterwards.
Update. To everyone calling him uptight, he really isn't. But I'm realizing he was way more affected by the miscarriages than I originally thought. This post has really opened my eyes that he is suffering, and it breaks my heart that I didn't realize it.
Yeah, fair enough.
Yeah.
Fair enough. We all make mistakes.
Mm-hmm. Yeah.
I don't know. I love to joke at my doctors when I'm at an appointment, even though I'm like literally training to be this. I find doctor's visits to be uncomfortable because like oftentimes your various levels of undress, you're talking about your health or your lack of health. And I love to joke. I love to do a little ditty. And this is a joke I would give.
Yeah, we live for the bit.
For sure.
We live for a bit. And so I support jokes to doctors. However, maybe doctors should not joke to their patients unless given space to do so.
This is, I am absolutely a dark humor person, and this is a thing that I luckily have not had to learn the hard way with patients yet, but is a thing where like friends have had to call me out and be like, you like really need to be a little bit more mindful and tone it down for certain audiences. Cause like, again, that is absolutely a mistake I probably would have made like, 6-7 years ago, is like trying to initiate the humor with patients. And I have to like remember like, nope, don't do that.
So what makes something funny, like the formula is novel. So it's not what you're expecting.
Right.
Mm-hmm.
And there's a little bit more to it than this, but it's really just two things: novel, and you do not perceive it as harming.
Yes.
Right.
The problem is that second one is so freaking hard to find. Like, you don't know where the line is where it's actually causing harm. Like, for example, with this husband.
And that's why we have to speak with the people doing frolics to sort of give
This
a
is
little...
probably also very different if the wife has maybe a history of drug abuse, and then you're like joking and it could...
I think if the joke had also been more innocuous, I guess, not directly something that affects the pregnancy. Because I think that's probably what was triggering for him.
And anyways, like the first time it happens, it's something to communicate, which he did, even though he was emotionally charged and may have said it a little bit more aggressively, a little bit more like, oh, you should not do that, even though like she has a valid reason to do that. But he's communicating like in the way that he's acting that it's something that he's sensitive to. Yeah. And it sounds like she was able to pick up on that. And
after posting it to Reddit, the implication was.
That's true. Well, and I do hope that like she's able to kind of like change that. It's like, it's hard to state what is an asshole act here just because it's like things happened, and the first time something happens without ill intent, then it's just
it's like the first time you accidentally like cross over someone's boundary, it's like that's not your fault, but once they communicate to you and it's like, hey, that really crossed a line for me, then it is your responsibility to remember that and
if
not do it again.
If she does this again at the next visit,
then that's exactly. Then it'll flip if you do this again. And also, like, props. I think you're exactly right. Where it's like the way for the husband to communicate this is not, hey, you shouldn't do that, but hey, it made me feel really bad when you did that.
I statements.
It's the I statements. It's the like, you don't get to determine what she says, but you do get to say how you feel about it. And then it's her job as your partner to respect that.
And I will say, like, I understand that gallows humor is a response to trauma, right?
Yeah.
And humor is it's one of the healthy coping mechanisms that we have available to us.
Mm-hmm.
But I will push back just a little bit that the first time can also be your fault if, like, a reasonable person could recognize that this audience was not the appropriate audience for that.
Sure.
For example, as a physician, I have to know before I go in the room, like, a reasonable audience is not going to be okay with some of the jokes that I might have just made in the break room to my colleagues, right? And I just have to draw that line immediately up front.
Totally fair. Totally fair. Yeah. And I also think there's an element there of like the joke was with her and the physician. And it's like, you know, I'm in a conversation with someone else. You're there. I wasn't thinking that, like, you know, you were part of this audience, you know?
I have been in these appointments, and I do not consider myself the primary the primary audience of anything that is going on there. Yeah. I just feel like I sit there and give my perspective if I'm asked, or if I've prearranged it. I did do that recently, but, you know, it was a conversation I had ahead of time. But the point is, like, I'm kind of there in an auxiliary sort of supportive capacity, especially in this case. But
yeah,
in a sense, family members are often part of the patient milieu. I hate to use French, but I know.
I bet you do.
So I don't know. Gray area, it seems like, to me.
I like the joke, though.
Me too. Yeah, I found it funny.
Yeah, I found it funny.
I would have laughed if I was the doctor. So.
Yeah.
Okay, so on to story number 3, which is about what all of us have to go through, which is so many different exams with a lot of different rules, and about whether you're kind of required to share things with your classmates and colleagues for those exams. It's like a group of
I'm a doctor, and a few days back, I gave a major career-defining exam with several other candidates. During the exam, you're expected to carry some of your own equipment, such as a stethoscope. One of the candidates forgot to get his own stethoscope. The examination center didn't have an extra stethoscope and asked him to borrow one from the other candidates. I was starting a little later than the rest, so he asked me for my stethoscope. Some background. I don't like sharing my stethoscope as it feels gross to put something in my ears that has been in someone else's ears.
Down with that.
Additionally, I didn't want to have to worry about getting my stethoscope back in time or getting delayed in any way for my exam if I lent it to someone else. Finally, right before the exam, I like to be in a focused zone, and I don't want to talk to or engage with anyone at all. As soon as he approached me and started to speak me, I said, "Please don't talk to me. I need to focus." I didn't want to think about anything else before my exam. I was mentally revising my examination routine and really didn't want to be disturbed. He said, "I need your stethoscope." He started pleading, and I very firmly said, "Stop disturbing me. Stop talking to me." He walked off in a huff and was visibly upset. I was pretty irritated too because I had been distracted and had to refocus to get back into my zone. After the exam, he was giving me nasty looks. It was pretty clear he did poorly. I think it's a reasonable guess that someone who forgot to carry critical equipment before a major exams probably didn't take preparation for the exam too seriously. A few of my colleagues think I was an asshole for not helping him and for refusing to talk to him. From my perspective, I felt he was an AH for disturbing me before a critical exam. I had been preparing for this for months. The instructions are clear to bring your own stethoscope. So, am I the asshole?
Oh, you didn't get there until right at the end, friend.
Okay. I can.
Now Julie has to defend herself.
Maybe did I space out at the end?
I just like here's where I come from. Like as a forgetful human being, I at least once a day put my phone down somewhere in my lab and then have to like run around to all the benches trying to figure out where the heck I put my phone down. I totally sympathize where it's like, if I forget to bring something to an exam, that's on me. If you don't want to let me borrow yours, that's okay. You're within your rights to do that. That's fine. where it is, it's like, okay, first reason, it's gross to lend your stethoscope. Fair. Second reason, you don't want to worry about getting it back. More than fair. Totally reasonable. Third reason, I was in the zone and you have disturbed my peace. I'm like, bro, like, or lady,
like,
bro or ma'am.
Assuming that he did poorly on the
yeah,
exam.
That was kind of an asshole
And that,
statement.
And then it's like, oh, if you forget your stethoscope, that must mean you just didn't care and you didn't prep well. I'm just like, you, man.
Hey.
Sorry.
I feel like maybe I just like want to see the good in people for like forgetting things, not the guy that's mad about the stethoscope asking. I feel like if I forgot a stethoscope, odds are this student or resident, whatever this was,
physician,
doctor, taking this exam.
I think they're taking like step 3 or something.
I like to believe that they are well prepared. I mean, the stats would show that most med students are incredibly type A. So I have a feeling that is true. I like to believe that if he or she forgot their stethoscope, they did it for a very good reason. Like, I don't know, their husband took their car or their kid stole it, broke it, whatever. I like to believe in the goodness of people. And like, if I was asking for someone to borrow a stethoscope because I had forgotten mine, I feel terrible.
Yeah.
And I don't know. I just can imagine there's a world in which it's reasonable for them to forget their stethoscope.
Hey, Dave, what's the fundamental attribution error?
It is the mistake people make when they believe that other people feel as they do.
Yeah.
So if I is that right?
You were really close, and I was so excited for you. Because like, why would you know this off the top of your head? It's a weird
something. I remember being taught this in college.
The fundamental attribution error is assuming that somebody's mistakes are due to a fundamental flaw in them, whereas my mistakes are due to happenstance. Right? I'm late to work because of traffic. They're late to work because they're a bad person. In this case, the man is making the fundamental attribution error. He is assuming that the person who forgot a stethoscope is a bad doctor or a bad student, which is unreasonable in any circumstance.
I like to try
Riley for not falling for that.
Yeah, thank you.
I like to try to assume good intention.
Yeah.
Yeah, agreed.
And also, like, if I'm being asked to directly by someone who needs my help to be charitable, I try not to engage in any sort of calculus that's like, well, do they deserve it?
Yeah.
Yeah.
Or what's the downside to me or anything like that. That's what I kind of try to do. So if somebody asks me for $20 on the street, and I have the $20, I'm not going to be like, well, you're just going to, I try not to think to myself, well, you're just going to use it for booze or whatever.
Yeah.
Like, I'm just going to kind of assume that and I think that's kind of analogous to what I would have hoped would happen in this situation. I get it. Though, you're in the zone.
I
would have liked
to get the zone. You can get, if you are so about your zone, the whole key point of a zone is that you can get back into the zone. Like, I just feel like if you are so meditative, the entire point is that you can get out and get back in.
I just imagine this person, like I'm imagining that this is I'm imagining that this is an OSCE where you go in and you talk to a patient. That's what I'm imagining. This may be an exam that happens in another country again. I'm not really sure.
It is because they give everything in U.S. dollars.
Oh, right.
That it's.
I didn't read.
No, the man says gave an exam. This is not the U.S. I'm guessing.
I don't know. Like,
gave an exam did throw me.
That was weird.
This is England or India.
Well, he says that his state doesn't have an exam center, so he had to travel out of state.
Okay. Well, it doesn't. I'm not sure it really matters. I just imagine this person standing outside the exam room with their clipboard.
Who's using clipboards these days?
I don't know, but when I was in the
I have not done an OSCE recently. So
when I was in the OSCE program, they used clipboards, and I just imagine them sitting there like in front of the door.
Yeah.
Like burning holes in their clipboard as they try to remain in the zone at all costs.
Yeah.
So do you know?
And the announcement comes over the speaker, and they're like, "Shut up! I'm in my zone."
Yeah. I can kind of understand, though, like sometimes people have a lot of anxiety around exams and they don't want to be disturbed. And the thing that really grinds like my gears about this was that he told him no. Mm-hmm. And then the person kept on asking and pleading. And that was the thing that was just like, absolutely do not do that.
Yeah, don't do that.
Kind of assholes.
Yeah. I like to believe in like a karma of sorts. So like in my mind, if I did not give that person the stethoscope, I would then lose my stethoscope and need to borrow one someday, and no one would give me one. Like, I don't know, maybe that's too woo.
It's one
like
person.
that's my same with like not picking up dog poop. If I don't pick up my dog's dog poop, I'm stepping in dog poop at some point someday. So like, I don't know. I like the goodness, but maybe I am too good, because then I was thinking in my head, what's another like real life example is like, okay, you buy a plane seat and you specifically choose your plane seat, and a family comes and they say, hey, we are separate. Can we have your plane seat? You can have this other seat, but you bought that plane seat. So like, would you move? And obviously there's a lot of context that would be needed to know whether or not to move.
Right.
The
But
answer is always going to be yes to that.
Yeah. And I think that's, I don't know.
Yeah, but for this person, like, they're not the only person there.
Yeah.
Yeah.
And it doesn't have to be them.
yeah.
But I can also recognize that in desperation, you push back on a no.
It does
Yeah.
also,
Which I
like,
get.
from the way they described it, it sounds like people are starting at different times. So maybe he should have asked someone who is just ending their exam instead
Yeah.
of someone who hasn't started it yet.
Yeah.
Like, basically, the onus is on you to take, because you are the person that forgot it, regardless of how it happened. Again, I'm sympathetic with people that lose things, but regardless of how it happened, the onus is on you to be the responsible one and be like, I want to add 0 more stress to your day. So here is my plan for how I'm going to borrow it, how I'm going to give it back to you. And I'm even going to like take the onus to find little alcohol wipes and clean it off, because I am the one imposing on you and asking for a favor.
I want to say something about the ears thing.
Go ahead.
As somebody who recently experienced a lovely ear infection myself, I bought a camera to look in my ear.
No, don't do that.
I did.
Don't stick things in your ears, Dave.
But also just don't look in there. I hate doing it.
I did it under the supervision of my audiologist wife. And I looked in there and I was like, I don't want, if I knew what was in people's ears.
Okay, counter, wipe your stethoscope off.
Yeah.
I take problem with people who I call not full-time germophobes. Like, they are contextually germophobic. And I feel like the same person that doesn't want their stethoscope in someone else's ears is the same person that's like gonna do something else that would be like way more germed up than like not washing their phone.
They're gonna be like,
I can't tell
nice to meet you.
Like, on the words, I spent like literally the last 12 months running around with gross people, physicians specifically, petri dishes. Let me tell you. And how many times I've like, I'm making it sound like I'm this guy, but like on more than one occasion, I happen to be in a room where my stethoscope isn't with me because I didn't expect this to be the case, right? And they're like, "Hey, just use mine." And I've used so many people's stethoscopes, and people have used mine. And at this point, it's like, meh.
Yeah.
It just is what it is.
I would like to offer up a new asshole. I think the asshole is the testing center.
I don't
for
think
not
that's
being
appropriate for a video
I think the
podcast.
asshole is the testing center for not being prepared for
But
the
these
fact that
testing centers are never prepared. They're never care
prepared.
about the students.
I will be the doctor that is prepared for the students someday. I will bring all of you.
Riley's going to arrive with 5 extra stethoscopes and 7 reflex hammers.
Yep. Hey, I'm going to keep them all on me at all times. I'll have a trench coat and they'll be like, what do you want?
They always seem to have everywhere.
I know. Well, because nobody I feel
no
like
one
a bunch
wants to
of
use them.
Well, I feel like a bunch of doctors I've seen where they test reflexes, they just tap it with their finger. Like, they don't even need to
New
take
plan.
out the little
Every
hammer.
single like ophthalmologist ever is going to donate their stethoscopes to these testing centers.
Oh, I
because
love that.
And they're
their words, not mine. They ain't using them.
Jeff,
So-
how often do you use a reflex hammer?
I forgot what it was until you said it. Just
All right, maybe we should move on to the next.
Let's do it. Okay.
All right, story number 4. So now we're moving on to people's conceptions of what makes a quote unquote real doctor.
Oh boy, here we go again.
I love these.
Is this the auntie one?
Yes.
Okay.
I'm getting a preemptive.
I am a plastic surgeon. I went through years of medical school and residency, but it was worth it.
Oh, is that
Years
it?
ago, when I first told my family that I was going into plastic surgery because it was what interests me the most, my parents, siblings, and brother-in-law were all supportive, and whenever I felt like giving up, they were always there to push me. But my aunts, cousins, uncles, and grandparents always made snide comments about it. They were all happy when they knew I was in med school, but completely flipped when they found out I was pursuing plastic surgery. It annoyed me at first, but I learned to just move on from it. But recently, my cousin on my dad's side, the daughter of an aunt who keeps making comments about my job, done a PLC in nursing and childcare, which didn't bother me. I couldn't care less what she does. But my aunt thought I should know everything that's happening with her daughter. Every time I see her, she goes on about how smart her daughter is and how amazing she is for doing a PLC in nursing and childcare. But the last time I seen her, she said something that really annoyed me. Me and my sister were over at her house when she said, "It's great that she's going into medical school. She's not. She doesn't even have the brains for medical school. Maybe we can finally have a real doctor in the family." I sat there in silence for a second, thinking, what is she talking about? And then looked at my sister, who looked equally as pissed off as me. I snapped back and said, her changing kids' soiled pants doesn't make her a doctor, and her knowing how to clean a cut doesn't either. She's not in medical school. She's too dumb for that. She wouldn't even last a week before dropping out.
Damn.
My aunt looked really pissed off and yelled at me for being rude, and then she told me I wasn't much of a doctor either. I yelled back at her that I went through years of med school and residency, and that I'm a licensed doctor and surgeon, and that she doesn't know what she's talking about. My aunt started crying and left the room, so me and my sister just left. A few hours later, I got a text from my cousin calling me a bitch for what I said and attacking her mom. I got more texts from other family members, and it somehow traveled to my mom's side of the family as well. Majority of them are telling me to apologize for yelling at my aunt, but my immediate family, mom, dad, brother, sister, in-law's girlfriend, are telling me not to. Now I'm being shunned by both sides of the family, and they're all refusing to talk to me and won't even let me tell my side of the story. So, was I the asshole?
No,
okay.
the aunt sounds kind of like.
I mean, gotta vote.
I'm gonna go.
So why I picked this story is I think it's so interesting to me that to hear someone say that a surgeon isn't a real doctor.
Yeah.
Because usually it's like the opposite, where people are like, oh, you're a psychiatrist? That's not a real doctor.
Mm-hmm.
Yeah, that was their initial plan, right? Was to
so
be
I just thought it was so interesting that this family devalues surgeons.
Well, I wonder if it's a plastic surgery.
I wonder too, but like, what
it is, because people think plastic surgery is like really shallow, and all you do is is like do nose jobs and
they
stuff.
They have no idea like how much actually goes into plastic surgery for like, just wound healing.
Like,
and
and also like, you know, reconstructive surgery. You know, like I went to a plastic surgeon once. Can you guess what work I had done?
Did you get a BBL?
Yes.
Two different sides.
Dave has the like, that's why I was out for
ass
weeks.
at
You've never. I don't usually show my ass on the podcast, but it is primo.
I want to know why people think yes, the asshole.
I'll defend this because I was really flip-flopping, but to me, the reason why I said you're the asshole is like, your aunt is being incredibly disrespectful. Morally, you are in the right. However, you didn't need to call your cousin an idiot. Like that for me was like
uncalled for.
Yeah, that was really uncalled for. It's like you're in the right. You could have just taken the moral high ground and like, you know, said like, oh, you know, she's pursuing a career, but that career is not a doctor, and you're being disrespectful to me. She didn't. She took the low road. She called her cousin an idiot and yelled at her aunt. And I'm just like, Don't do that. Don't be petty.
Sometimes you can be right and then make yourself wrong.
Correct. Yeah, like you were correct, but you did do something shitty.
I think to me, it just like, that is not a great way to handle it. But she was talking about how the aunt does this constantly.
Mm-hmm. Yeah.
And so to me, it was just like she
reached a breaking
finally
point.
hit a breaking point, and she was like, I can't take the high road anymore. I gotta go this low road.
Yeah. Yeah. I stand by my why the asshole. I do it gently though, because I understand where she's coming from. But like, if we're judging the specific action, which is what this commenter is asking for, in this situation, yes. Were you completely in the wrong? Probably not. But like, yeah.
It's not about whether or not you're right or wrong. It's how you handle the situation.
Yeah.
And at the end of the day, this is not a zero-sum game. More than one person can be the jerk.
Yes.
Mm-hmm. And this family, it seems like it
yeah,
I'm not saying it's hereditary, but
I am so glad that my family is not this close.
Yes.
Oh yeah.
Like, do we have a group chat? Yeah, we have a group chat.
Oh, mine doesn't even.
It's so far, it has not blown up with this sort of thing. Usually it's like, you know, hey, here's a meme, or haha, or congratulations, you got into college, you know, that sort of thing.
Never, you're a bitch.
Yeah,
yes, like
everyone though, like I could think of maybe some examples of like, oh, if that kept going down Like, if that kept happening for years, I could blow up. I could.
Oh, yeah.
I could have a moment.
This is what I know about myself. You can push me a ways.
Yeah.
And then I will
am
suddenly
a fiery
turn
person
on you.
who was raised with other fiery women.
We
were fiery at all times.
The family tea. Like when Thanksgiving came around and everyone was posting about how they were just like making passive aggressive comments to each other, like, "Oh, how's the not being in like having a job? How's the divorce?"
Yeah.
So here's where I'm coming from, though. Because absolutely, she's been pushed and pushed and pushed and finally went off. Why did she go off and start? Again, I'm coming back to this because it's really the thing I'm hung up on. Why did she go after the aunt's daughter and not the aunt? Because I would have been like, if she had said like, "Hey, you are a bitch. You are belittling me. Why? Like nobody in this family loves you. You're a gossip." Like that all warranted. I would have been like,
No one in the
all the
family
way, call
loves
her
you.
up.
That's warranted.
Honestly, it kind of sounds like she's a bit of a busybody. But again, the fact that she brought the cousin into it, insulted her intelligence, and basically belittled her profession is like, that's where it crossed the line for me.
Unfortunately, the cousin became the scapegoat here because of just the like, oh, aunt calling her not the doctor for all this time. Suddenly, aunt is calling her daughter a doctor despite technically not being one. Unfortunately, the cousin is the scapegoat, but I agree. It's not
also,
right.
like-
And I did say she's not the asshole originally, but I would like to stay strictly in the middle because you're not the asshole for being mad that your aunt said those things. But I agree with the concept, which is you can only take control over like how you react. It's not about what was said, it's how you react to it. And that is a lesson I continue to learn as an adult.
I think it's really important that people remember that anger is evolutionarily very old, right? It is a valid part of the human experience. What you do with it matters. And she was mean, and that's that. That is like the definition of what we're talking about here. You can leave. You don't go over to your aunt's house for tea at all. I don't know. Yeah, I probably wouldn't have spent a lot of time. I have lived purposefully on the other side of the country from family members like this to avoid these conversations.
I feel like I also would. I think it's important. Look, I think it's important, people. I was looking at the time. I think it's important, people, to manage expectations in families. I've said this before. I'll say it as many times as I need to. If you're in a situation where your family is going to insist that you be a certain way, and insist that you do certain things, insist that you be there at certain times, whatever it is, you're gonna have to at some point tell them your expectations are not going to be fulfilled. You can do that passively, as I did, by forgetting many things that I should have remembered, like birthdays and things like that. Now the expectation is that I won't remember, but I've gotten older and I do remember now. Anyway, my mother's always very pleased that I remember to call her, even though I'm 53 years old. And yeah, it's about time.
So another example, go to sleep angry, wake up, talk to your aunt, write her a letter the next day. Maybe this is time where you let it veg.
Get up and
react.
leave.
Get up and leave. Go take a walk.
Yes.
People love
maybe
to do
don't
that.
talk to your aunt. Maybe just
don't go. That's what I was.
Stop talking to her.
I think that's where I was trying to get at. I was agreeing with Jeff.
I fully stand by the if it's not working for you, live in a different state.
You get out.
Yeah.
Okay, I do have to head out.
Yes.
Okay, so
thank you for coming, Julie.
I am trying to get out.
Good luck with your day.
Good luck.
I like your hat, by the way.
Yeah, your hat is amazing. Keep going. Your hat is amazing and you're amazing. Bye.
Okay. Have we reached the next one?
Yes. Okay.
I love the fact that I'm looking at your laptop and I get to like preview the titles before these because they're amazing.
Yes. So this last one is one of my possibly favorite stories in all of the Am I the Assholes that we've done so far.
Okay.
So listeners, if you've made it this far,
I
you're in for a
personally
treat.
kind of think it's like a great feel-good story. But you guys can decide what you think it is.
All right, here we go.
My sister is gifted and an amazing person. Throughout her life, she has said she wants to be a doctor. She graduated from a prestigious college with a 4.0 GPA. However, my parents have always told her that they want help with their company, and they put her to help them out. After graduating, their request increased, to the point that she gave up studying for the MCAT to help them out. After a year, I saw that she was going nowhere, So I decided to help her out by telling her that I wanted to be a doctor and would like her to help me study for the MCAT.
Damn.
My sister, of course, being the sweetheart that she is, decided to help me study. I started telling her how nervous I was and how I wished she could take it with me. She told me she couldn't because she needed to help my parents first, so I started fake crying and acting depressed. She took pity on me and decided to take the exam with me. Moving forward, we both took the test. She got an amazing score, 525.
Whoa.
She was super thrilled, and that day she told the whole family that she would apply to med school for this upcoming cycle.
Love that.
My dad questioned why she had taken the exam, and she mentioned how I had inspired her and that she and I could apply to the same med schools to go together.
Oopsie.
Now my parents asked, since when I wanted to be a doctor, and the truth was revealed. My parents lost it saying I am ungrateful and that she needed to help out because they put her and me through college. Which is not true because she got a full ride. They paid for me though. My sister also said I had manipulated her and she got mad. My parents won't talk to me and my other family members agree. My sister did end up applying to med school. She has interviews to 7 med schools, including UCLA, West Virginia, UMD, and JHU. I haven't been able to talk to my parents because they just don't want to talk to me.
Let's just do the update.
Update.
Update. I talked to my sister and apologized for my actions. She said she knows I only wanted to be a good brother and help her, but I was the only one who hadn't manipulated her, and that's why she was let down. However, after accepting my mistakes, she forgave me and we have gone back to normal.
I can't imagine that this person is the asshole.
To be fair, Julie preemptively decided that.
Oh no, Julie, come
Julie's
back.
gonna have to argue this.
Judge your actions.
Julie preemptively decided
I'll message her in the
that
Zoom.
she is the asshole.
Julie didn't know. She just went at random.
Yeah.
Okay, to argue from Julie's perspective, categorical imperative, you don't do something, it's always bad to do the thing, right? Manipulating your sister is wrong.
That's bad.
Yeah, not great.
Period. I think the because I am not Kant and I'm not a great person, if I had ever thought to be this manipulative of my sister to get her to take the MCAT on accident like this, I just wouldn't have told them. I think that was his failure. It's not about
How
morality.
do you then take the MCAT and then choose not to go to medical school? How do you...
how do you
that's true.
work your way out of that?
They could have told them that they got like a really bad score.
Yeah, like I tanked.
Oh, sure.
Yeah.
Oh, I tanked it. I can't
Now
go
I can't
anymore. I'm so
apply.
sorry.
No, I
but my
was just-
sister...
And then you
I'd
spend
be
the
like,
next 3 years fake
let's
doing the
apply,
MCAT.
and then just like, I didn't get in anywhere because you didn't actually apply. That's how you do it. It's no big deal.
Yeah, it's like wait
I
until
don't
she's
know.
actually gone to med
That's
school
true.
before you reveal it. Now,
Yeah,
that
they
being
didn't have
said,
to say anything.
I love this because it is such a good I was reminded, I went to go see currently at Riverside Theater, they have the It's a Wonderful Life play going on, where it's like, that story kind of hits a little bit differently now of like, oh, look at this guy who did nothing wrong, but keeps getting screwed over by the universe. And this is like, you just saved your sister from being that guy in It's a Wonderful Life, and actually it's like no, your self-effacing and self-sacrificing nature is not gonna give you up your dreams now, like just yank you out of the feel-good Christmas story, which I love.
Yeah, this one made me really sad for no reason other than like I am an oldest child and my parents have never like pushed me into anything, like, and for that I am eternally grateful. But like I am the kind of personality that like if my parents were like, we paid for your college, therefore you like owe us, like I feel like I would be that.
It's not how it
would
works,
do that
family.
if my parents were like, thank God I have great parents that do not do that. But as like an oldest child, which I'm assuming she is, we don't know like if it's just the daughter.
Oh, the other one.
The
The
daughter.
sister.
I'm
Yes,
assuming the
okay.
sister is the
Yeah.
oldest and or maybe the only daughter. Either way, like that made me, I just like felt crushed for her based on the way that the parents were like forcing her, it sounds like, to do
Classic
stuff.
Luke Skywalker situation.
Yeah.
Classic.
I just think like in all of the Am I the Asshole stories we read.
What
of,
about the moisture
all of these,
evaporators?
like bad families like being so mean to their children and
Yeah.
saying like you can't be a doctor, you're too dumb.
I know.
I think it's just so nice to see these siblings fighting for each other and doing good by each other.
Yeah. And it's like, I totally get where the sister is coming from in terms of like, you know, you're the only person in the family that I thought I could be honest with. And it turns out you were lying to me. I get it. I feel like in like 5 years, she's going to come around and be like, I see what you did. And like, you know,
this is.
yeah, it's like, and even if it's like, there's an extent to where it's like, yeah, I guess you did manipulate me, but also it's like, if she really didn't want to take the MCAT, like there was a point where I'm going like, like if he's like, no, I can't take the MCAT, will you take it with me? There had to be some suspicion in her mind of like, this doesn't make a whole lot of sense.
Also, like, you could have gone just for moral support if that was your whole thing. Like, she didn't have to actually take it, because I gotta be real with you, I don't know if there's anyone that I would take the MCAT again for.
No, not at all.
It's a long test. You got to be there the whole time.
You mean
it's
if your mother,
I'm like,
if grandma was like, if
So,
grandma
like,
was like, I'm not going to see any doctors if they aren't you, and I have cancer, you know, like, and you've got to fix me, you would be like, well, I'm sorry, I can't take the MCAT.
Yeah.
I'm just kidding.
No, this one's crazy. The parents, though, ugh, we need to.
Parents are the assholes.
Parents are the assholes.
The parents
they are the assholes.
Yeah, and also
again,
children live
manage
their dreams.
expectations, children.
Yeah. Any parent listening to this, you don't send your kids to college for your benefit. You send your kids to college for their benefit.
That's a cultural.
Her to college.
Yeah, but even
got
if they had, bad argument, because it's like if you're saying it's like, oh, like your children are not your investment that you can withdraw from. Your children are people.
You don't
I think
give
there is a
things to your children
cultural
with the expectation they'll give back. Like you give things to your children because you had them, and that was the expectation of becoming a parent.
Okay, but what I've learned as not a parent, but from outside looking in, I don't necessarily. Parents are doing the best they can.
Oh yeah,
not all. Period.
Yeah. No, I mean,
hashtag not all parents.
That people having kids.
Yeah.
Period.
I think
parents are doing their best.
People be having kids.
That's a fact.
People be parents. People really do be parents.
I think there is a. I feel like there is a cultural difference in how parents view children and going off and being successful and all that kind of stuff. Where you do owe your parents something.
Yeah.
But is that right or wrong? Like, I think it's wrong. I don't think it's the best way to go through life.
I don't think it's a bad thing culturally for like family members to rely on each other, like parents to like ask for favors and a good context from their children, etc. Like, I don't think it's bad for a child to go work for their family's business. I think it just needs to be done without coercion. And that's where it becomes.
Did they say what the business?
I'm looking to see, but I did find cultural context, if anyone wants it.
Sure.
The mother in this family was born and raised in Korea.
Okay.
And the dad, his parents were from Germany, but the dad was born and raised in the U.S.
Okay. I don't know if that second one is an issue, but
I mean, I'm not.
Could be the first one. I'm not
Korean American, so I don't know.
Yeah.
But
well, and I would also say, regardless, like. I guess not regardless, because, you know, I am from a U.S. West cultural perspective, so it's a little bit like, you know, different. But I stand by what I said, where it's like the things you owe your parents are like respect and, you know, honor and gratitude, because it's like, again, there's a caveat here of unless they were like abusive, and in that case, like bets are off. But like assuming that they raised you okay, those are the things you owe them. You don't owe them the remainder of your life.
Yeah. Also, the parents work in real estate development.
Not a bad one to get into.
Not for
real estate is on like my top 5 thing of like, if I get into this, assume that like I'm an imposter, I've been replaced by an alien. Like, no. I don't care about the money. That just like eats your soul. I hate that. So I'm so sorry if any of our listeners are real estate developers. I'm sure there are good ones out there.
I'm skeptical that our listeners might be real estate developers, but
I love the concept of someone sitting there being like, it's either real estate developer or medicine. I'm going to listen to this podcast.
Yeah,
I've been waiting for this episode.
I've got to figure this out.
I got to figure this one out right now.
We're here to tell you, just go take the MCAT, see what happens.
See what happens. Everyone gets a 525 just taking it.
Ask your sister to help you study.
Yeah.
It'll be great.
It'll be great.
Well,
oh man,
I think that's our show. I'd love to thank Jeff and Julie, but they had to leave to go be
They said you're not welcome.
Students.
They said they hate you.
Aww. But I can thank Holly, Miranda, and Riley.
You're so welcome.
For being a part of it. And what kind of cretinous brute would I be?
Ooh.
Is it cretinous or cretinous?
Cretinous.
Okay.
Honestly, I don't remember this word.
I feel like it's cretin,
Maybe
but
it could be
because
either.
cretin and cretin, I believe, are both correct pronunciations.
Okay.
Are they?
I've heard both. That might be like a US UK thing, but I've definitely heard both. I think we say cretin in the US, at least where I'm from.
Well, either way, I don't want to be that. So I'm going to thank you, Shortcoats, for making us part of your week. If you're new here and you like what you heard today, follow the show wherever fine podcasts are available: Spotify, Apple Podcasts, Google Podcasts, YouTube. The show is made possible by a generous donation by Carver College Medicine Student Government and ongoing support from the Writing and Humanities program, which I appreciate. Our music is by Dr. Vox and Catmosphere. I appreciate that.
Yeah.
I'm Dave Etler saying, don't let the bastards get you down. Talk to you in 1 week.
And I'm here saying, don't forget to present your assholes.
Wow.
Hi, Shortcoats. Look, life in medical education, life in America, life in the world is often difficult. And I often wish I could help. All I have is this podcast, but in my wildest dreams, you have the support you need to lead a life of your choosing. You deserve to be happy, healthy, and successful in whatever ways you define those words. So if you need support because you've experienced racism, discrimination, harassment, mental health crises, I want you to be able to get the help that you need. And so I'm going to put some links in the show notes to some resources that you can use. But the bottom line is that, for what it's worth, I see you. I know you're out there. I wish I could do more. Maybe I can in ways that I don't understand yet or know about. But I see you, and I'm glad you're here, and other people are too.
This Shortcoat podcast is a proud member of the MedEd Media Network. Inspiration, information, and guidance on your journey to medical school and beyond at mededmedia.com.